and welcome everybody. It's brilliant to see so many people here this evening. And I think it's fair to say when we set this up, life seemed a little less rosy than it does today. I think we're all feeling a little more cheery this week than perhaps we were if we'd had this meeting last week. It's a broad theme. It's testing, it's vaccine and mental health. And I think one of the things we want to think about is what have we learned and how could we do things differently in the future? And are there lessons also that go beyond the narrow topic, if you like? So one of the things that obviously you'll all know is that within Big Tent, we're really committed to the left behind areas, to how regeneration can be done in a more creative way. And so it's particularly brilliant, I think, that one of our speakers tonight is from a company in the Northeast. It's particularly appropriate, I think, for Big Tent that that's the case. And it's brilliant to see Jeremy here. Thank you so much for giving your time. Obviously, Jeremy Hunt is former Health Secretary and currently Chair of the Health and Social Care Select Committee, hugely experienced and knowledgeable on this topic. And Jono O'Halloran is CEO of QuantuMDx, which, as I say, is in the Northeast. And you're going to talk to us, I think, about your recent experiences relating to testing too, which will be fascinating. Can I first start by handing over to Mark Foster-Brown for AJUVO to introduce us?
Thank you, Sally. It's very good to be with you all today. AJUVO and its members have supported the Big Tent Festival since it was established back in 2015 by George Freeman and by Sally, who's leading today's discussion. During that time, both our members and our company founders have participated in panels primarily around entrepreneurship and new technologies. We are primarily focused on companies that are of the moment. But when QuantuMDx co-founder Elaine Warburton spoke at the Big Tent in Cambridge back in 2018, none of us could have predicted how relevant the hopes and fears tent would become just 2 years later. Since January of this year, Jono and his team, and he being the inventor of QuantuMDx's technologies, has been driving forward to deliver a testing regime that is critical to our recovery. He also sits on the British Diagnostics Industry Task Force, advising the Prime Minister and Matt Hancock. So he is uniquely qualified to discuss the state of testing in the UK and its importance to all of us in the coming period when vaccines are being rolled out both here and abroad. So AJUVO is delighted to support today's Big Tent digital discussion on the road to recovery. Thank you.
Thank you, Mark. Thank you. Jeremy, with no further ado, straight over to you to just give us some 5 minutes or so, 5 minutes, 7 minutes, whatever takes your fancy.
Thank you, Sally, very much. And good evening, everyone. I mean, I'll just make 3 points to stir up the discussion. I mean, first of all, I do think the optimism that people feel this week is justified. I don't think this is a false alarm. And I think that the arrival of a vaccine that has been licensed for use after exhaustive, incredibly thorough testing means that we can start to plan for life going back to normal after Easter. And I've booked my summer holiday, and I think we can all safely do that. I think it's likely there'll be elements of social distancing, potentially mask wearing and so on that carry on after that time. But by Easter, the expectation is that all our vulnerable citizens will have had the vaccine, and that means that the immediate threat to life that the virus causes will go. And that is an incredible step forward, combined with the progress that's been made on testing, which has also been substantial. And I think it is also important to say this is a big British victory too. The virus, the vaccine was developed in Germany with American backing, which is obviously in a way the primary achievement to develop the vaccine, although we are developing a pretty good one here as well in Oxford. But the process of approving it is incredibly difficult because vaccines are the one medicine that you give to people who are wholly healthy. Yeah. So the issue of side effects is much less problematic, for example, in chemotherapy, because if you've got someone who will die anyway from cancer, their tolerance of side effects is very high. The tolerance of side effects for someone who's wholly healthy is very, very low. And so approving a vaccine is much more difficult than approving ordinary medicines for use. And they were extremely innovative. And we had Dr. June Rain in front of the select committee. She confirmed that this really is a big achievement for British science and British scientists, and confirms us as being absolutely at the top table globally. The first country in the world to approve a coronavirus vaccine that is clinically approved. We know that the Russians and the Chinese have been giving out vaccines, but they're not releasing their research. And so it's impossible to know whether they've been through all the safety tests. This one definitely has. So the big tent, and I'm delighted to have my colleague and friend George Freeman, one of your illustrious founders, on this evening's call. It was really formed to do some blue sky thinking about the future. And I just wanted to leave you with a couple of thoughts as to where this leaves us going forward. The first is that I hope that we use this moment when we've had a year of really thinking about health and social care and how central they are to sort out some very long-standing, intractable problems in the health and social care system. And I'll give you a couple. There are many, but I'll give you a couple. The first is the NHS is very close to our heart because of the values it represents. The idea that it doesn't matter who you are, rich or poor, young or old, you can always access healthcare. We were actually the 6th country in the world to introduce universal health coverage. New Zealand was the first. Good on the Kiwis, but we were definitely the most famous. And by embracing it in the way that we did, Britain made universal health coverage part of the definition of a civilized country. And that is why it's now aspired to all over the world. But if we're honest, what the NHS has never cracked is being the highest quality healthcare in the world. We are not bad, but on the European league tables, when it comes to things like cancer outcomes, we are in the middle of the pack. On some things a bit better, on some things a bit worse. The British people care about their health. They want the NHS to offer the best healthcare. That's surely consistent, or the only way to consistently deliver Nye Bevan's vision, because the dream wasn't to deliver mediocre healthcare for all. Not that the NHS is mediocre. The dream was that the healthcare that the richest people could afford should be accessible to everyone. And I think this is a real moment to put the same emphasis on the quality and safety of care as we put on access to care, and also sort out the social care system, without which we can't deliver the improvements in health that we want. And frankly, I think we are a kind country. It's not something that's normally said, but I think that is actually one of our national virtues. And the way we look after older people, frankly, is unkind. The way care is rationed into 15 or 30-minute slots. But we can do better than that, and we want to do better than that. And so that's my first blue sky thought. My second blue sky thought is, how the hell is Britain going to earn its crust in a post-Brexit world in which China will probably within a decade become the largest economy? What's the way that we're going to make it in the 21st century? And I think that we should have an active national strategy to be the world's next Silicon Valley, using the incredible foundations of some of the world's top universities, 4 of the world's top 10 universities, according to some rankings table. The fact that we are the most enterprising country in Europe, our incredible networks all over the world, and the fact that the life sciences revolution, as George Freeman knows far better than me, is in the next couple of decades going to transform humanity every bit as much as the internet has in the last couple of decades. I'm sure that in 10 years' time, the names on our lips won't be Google, Amazon, and Apple. There'll be 3 names we've never heard of before that are allowing us to hold our own decoded human genome on an app that helps us to predict whether we're going to get cancer before we show any symptoms at all. And this is the revolution, which our nimbleness over the vaccine has shown that we are absolutely well placed as a country to do. And I think it's worth casting our minds back to the 1980s, 1984, in fact, when Nigel Lawson had the vision to introduce Big Bang to the City of London. And in doing so, he took the promise of London as a financial services company, and it was a very promising place, but it was only first amongst equals compared to Paris and Frankfurt. And by a series of enlightened policies over a 15-year period, London became one of the two global giant financial centres, which has been enormously important to the British economy. And I think we could do the same again for technology and life sciences. This is our opportunity, and off the back of this horrible pandemic, wouldn't that be a fantastic way of creating a silver lining out of a very dark cloud? Over to you, Sally.
Jeremy, I'm going to go straight over to John. I want to ask you one tiny little question about what you just said, which is very unfair of me from the chair, but in that big tent way, I agreed with practically everything you said. One question back: how do you put together we are a kind people, and presumably by that also a reasonably fair set of people? How do we translate that into rebuilding the economy and becoming a new Silicon Valley? How do we make it perhaps not quite like 1984?
Well, I know what you mean, because the City of London unleashed the kind of the yuppie boom, which left a nasty taste in people's mouth, and in some ways we didn't quite get it right, because we ended up with the financial crisis in 2008. But the answer to that question is a very important, to cut to the chase, Sally. I think you have to have incredible incentives for entrepreneurs to make billions and become the next Jeff Bezos, if they are actually the people who set up companies and take the risks. But be prepared to have a very progressive taxation system for everyone else, where wealthier people are prepared to contribute more to have decent public services. So that's how I personally would square that circle.
Thank you, Jeremy. Well, that's a very, very, very suitable entry to you, Jono. Over to you.
Great. Well, thank you very much. Yeah, it's a wonderful opportunity to speak in this forum, so I appreciate that very much. As Mark said, I am co-founder, CEO, and inventor of QuantuMDx and its technology, which is a small portable box that can run a swab to PCR answer in under 30 minutes, which, you know, as you can well imagine, within a pandemic would be really quite important. And we have been developing this now for the past 10 years and have been working closely with the government to scale what we're doing so we can provide yet another testing solution to this problem of this pandemic. But you know, I'm here to talk more generally about the role of testing for this control of the virus.
Do feel free to pick up Jeremy's point about entrepreneurship as well, actually, because your experience of that would be really valuable to people too.
And I think that is a critical aspect of what we're doing. I mean, for me, I set a company up in my garage 12 years ago, so I'm hoping to be one of those new Amazon or new Apple companies that Jeremy was talking about. And he's absolutely right. We have to do what Silicon Valley did, make a lot of big bets. 100 of them won't work, one of them will, and out of that becomes a significant company. And you need to support throughout all the from the ideation step all the way through to scale with both public and private funds. And at this moment in time in the UK, we don't necessarily have the VC environment that will allow us to build global companies in the diagnostics sector specifically, and maybe even as life sciences. We see a lot of the companies now moving away to America before they get big, with Oxford Nanopore being one of the notable exceptions. But you can see why. It's because it's difficult to raise the significant money required, and over that long time period. I mean, we've been developing QPOP for 10 years. So it's having the full ecosystem there from the ideation to scale, which is going to be important for that. Yeah, and so from my experience of the pandemic, it was pretty clear. I was at the end of last year. I was in China, and we really saw the start of it. It was very clear to us that something big was happening, and we started developing technologies and tests for the SARS-CoV-2 outbreak. And it was in early discussions with government, we clearly started to understand that there was a significant issue. We were not prepared for it. There have been years of cutting costs in pathology, centralization, in not investing in the skilled pathology staff required for this, closed platforms that we brought in to run tests, all of which, by the way, is not a mistake. This is, without a pandemic, these are by far the correct decisions to make. It just so happened that a pandemic hit and exposed the fact that it was not set up for a pandemic. Because what you really need is decentralized testing, rapid PCR testing, so that you can get the gold standard PCR tests, which are highly sensitive, in the local area, so that the local health authorities can deal with their people, get the results back to them. Importantly, have the samples so that they can use them for an analysis of new tests and technologies, rather than what we have right now, which is centralization into the lighthouse laboratories, and tests and samples are then disposed of immediately, but there's no access to them. For instance, a good example, right now, we're trying to validate our technology, and we can't through the NHS because positivity rates are so low. But the lighthouse laboratories are still seeing a high level of positive tests coming through, but we can't access them because it's not within a secure ethical framework that we can get to the sample, so they're thrown away. If it was decentralized, that would be a completely different story. So whilst the lighthouse labs were an incredible feat, and an amazing job that we put together there. Further on down the line, we need to be investing more in decentralization. Yeah, and I look at the press and I see a lot of stories that are quite negative about diagnostics. The fact that the vaccine is now out, so we don't have to test anymore. That's missing the point completely. I mean, there's only going to be certain groups that have been prioritized initially for the vaccine. Other people outside of these groups will still need to be tested all the time. Travelers coming into the country will need to be tested. And other marginalized folk will need to be tested. But also you need to keep on testing those people who have been vaccinated, because you need to understand and monitor the efficacy and success of the vaccine. That's extremely important. And the most important aspect here, the easiest to understand, is assuming the vaccine provides 90% protection, that means 10% of people won't be protected. And we don't know who those 10% are. So we still have to keep testing everybody for a number of years so that we can ensure that we do identify those people who do not get an immune response and get protected. And so that's very important when we're thinking about diagnostics. And in this period of time up to Easter and beyond Easter as well, we're going to have to test all of the different demographics carefully, because we don't know if 90% is across all age demographics or if there's a different split for the older, more vulnerable groups. Moving on to a diagnostic strategy that we're building at the moment in the UK. I see in the press a lot of talk about sensitivity and specificity, and there seems to be a bit of a misunderstanding about what these statistics actually mean and how you analyze what they mean. Obviously, we know that PCR is the gold standard. It has a very high sensitivity and specificity, regardless of what population you're testing. Because there's a population of people with severe disease or asymptomatic, it will just pick up the disease, because it is able to detect viruses in very low copies, in around the 500 copies per milliliter or under, which makes it a very powerful technology. And generally, it's not going to be missing a positive patient. So if you imagine a population and 10% of that population has the disease, PCR will pick up the majority of those positives. But then when we start looking at lateral flow tests, we're seeing reports of anywhere between 58% and 78% sensitivity. And so people get scared about this. And they wonder, why aren't we using PCR tests more for everybody? Well, PCR is a complex technology and requires skilled workers. And so to be able to do these tests, generally you have to run them in the laboratory. And we just aren't set up for that. We've got lighthouse laboratories, but with 48 or 24 hours to 72 hours turnaround, it's not really helping. It's not applicable to mass testing. What we really want to be doing is testing everybody at least once or twice a week in the UK, so that we can get an understanding of the positivity rates. When people then say, well, sure, you can do that with lateral flow testing, but you're going to miss, for instance, if it's a 58% sensitivity test, you're going to miss 42% of positive patients. But of course, importantly, this is in asymptomatic population. So these people don't know they have got disease. So they haven't a clue. So we will be picking up 58% of people we wouldn't have been picking up before, and they will then.
Let me pause you, because otherwise we're going to get so detailed into the technology that we won't have some of the wider questions. Because I think what you're describing what you think is a successful testing regime, and we've had a load of questions, needless to say, about test and trace, and I'm just going to try and group some of them together,
sure,
and then you can both have a go at them. Rory Tapner, very nice to see you, Rory. I haven't seen you for a while. If money was no object, you'd expect to get the Rolls-Royce system of test and trace. Money has been no object, but we don't seem to have had a Rolls-Royce. Why is that? And is part of the problem that testing wasn't identified early enough as being a significant part of the solution? And I guess, what are the lessons for that going forward? And from Jeremy White, what's the point of testing outside of specific settings, such as hospital staff, patients and care homes, staff, residents? It's a massively expensive operation. I suppose I would add to that, how do you see that running in parallel with vaccines? Say we get to June, July, how much testing do you think will seriously be being considered by the government, and how much should be considered, and what sort of testing? Jeremy. Oh, God.
You have to have a plan B. So it's very, very important that we continue down the road of mass testing. I think Jono is absolutely right to say that we've got too hung up on the issue of false negatives when it comes to lateral flow tests. With a mass testing regime, the point is you're reducing risk. You're not ever going to eliminate it. And the more widespread the testing is, the more you succeed in reducing risk. And anyway, it's going to take us 2, 3, 4 months to get these vaccines out to people who need them. And in the meantime, families are going to want to visit loved ones in care homes. We're going to want to, test schools where we think there's a positive case, and so on. And so it's absolutely essential, having been through so much pain in the last 9, 10 months, that we don't throw it all away by counting too much on a vaccine before it's really going to have an effect.
What about a bit beyond that, though? Say we get to, you've said you booked your summer holidays, so we get to July, and everybody pretty well who needs it has had a vaccine, we hope, by then. What do you think the government's position should then be on test and trace?
Well, we don't know the answer to that, because we don't yet know whether the vaccine will stop transmission. So a tetanus vaccine, for example, doesn't stop transmission. Yeah. And if it stops transmission, there's a good argument to give it to everyone, including children, in which case the role of testing might go right down. But we may find that actually this is a vaccine that stops you getting ill if you catch it, but doesn't stop you passing it on, in which case we are still going to want to identify people who can pass on this virus asymptomatically. And that means that we're going to carry on doing testing, and it's going to become a much more normal part of life.
Right, that's really, really clear. Thank you. So, Jono, picking up on that, again, if I can ask you, sort of, come July, what would your perfect testing regime be then? If the government was listening to you, what would you be advising them to do in a way that is, efficient, maybe doesn't quite cost as much as Rory was talking about, but actually works and people feel positive about it?
Yeah, so I mean, for me, it's a combinatorial approach of testing using cheap, easy to use lateral flow over periods of time. So 2 or 3 times a week, those who come up positive are confirmed with a PCR. Those who have been confirmed with a PCR will provide their contacts, and those contacts will be then tested with PCR. And that will just halt transmission dead. We know that we've been doing that in our office now. We've picked up 10 different cases of COVID, and we are working within the same office and have had 0 cases of transmission within the office. Now, if we can just scale that across the country with the use of lateral flow and PCR, then we've got it cracked. And in terms of testing alongside a vaccine, we have to really be careful of thinking that testing is going to drop. Testing has to monitor efficacy. Testing has to be there for those 6.5 million people who will not get protection. And testing has to be there for identification of when the protection runs out, because it's the vaccine likely won't last forever in terms of the protection it could provide somebody. Is that 6 months? Is it 2 years? Is it 5 years? We just don't know at this stage.
How do you think we can explain that to people? Because I think, I suspect there's other people will share my concern, which is that I'm not sure an awful lot of people really understand that and think, oh, you know, whippy, the vaccine's coming, life will return to normal and it's kind of job done. How on earth do we communicate that more effectively with people? How do we have a conversation with people that is meaningful?
From my perspective, that's very tricky, but I think the use of social media, of infographics and that sort of thing will be very, very important to get the story up. And it has to be repetitive, and you have to keep saying these things over and over again, so that people just start understanding it. And people are getting used to testing being around all the time. But it's just the message that we need to ensure is that, yes, we've got a vaccine and it's brilliant and it's fantastic and we're going to get onto a new normal, but testing is going to be around for years to come.
Jeremy, anything else on that?
No, I think Jono's right on that one. We're still in a very tentative stage. That, you know, today's news that some people with allergies may not be appropriate to receiving the vaccine is just an example of the fact that we're going to understand much more. And Chris Whitty and Patrick Vallance were saying to the Select Committee this morning that they're expecting a world in which there are 3 different vaccines that have been licensed for use. So I just think that's why we have to keep all options on the boil, if I can put it that way, in a rather unscientific way.
Yes, that's fine. Can I ask a couple of questions on vaccines that have come in? From Sarah Marsh from The Guardian, what does the government need to do to address those who are worried about taking a vaccine? How do you respond to those who say it's been made too quickly to be safe? I mean, I think we covered that bit earlier, but how do we convince people who are worried? And Jill asks, is the vaccine safe? Jeremy?
The vaccine is safe. We have, one of the most thorough regulators in the world, and they absolutely have put it through its paces. I have absolute confidence in them. I will take the vaccine myself when the time comes. If it's recommended for my children, I would take it for them. Of course, the government and all people in prominent positions need to counter the propaganda from the anti-vaxxers. But I don't think this is going to be a particularly huge problem, I have to say. I think most people are so desperate to get back to normal life that they've been waiting for this moment. And I think British people are, we're tough in a crisis, and I think we won't have a problem. I mean, there may well be a small minority of people who choose not to take it, but I don't think we're going to have a significant issue with sort of public scare stories, if I can put it that way.
Yeah. Jono, anything to add on that?
Yeah, well, I mean, I think when you look at what's required to get to herd immunity, it's 2/3 of the population. I think Patrick Vallance was saying this morning on Sky News. I think we should achieve that quite easily. I mean, after all, this is an RNA vaccine. It's about as safe as it gets. The reason why we managed to get it out and validated and approved so quickly is is more money has been thrown at it than any other vaccine. There's been more people working on it than any other vaccine, and there's been more patients who've been recruited to test it than any other vaccine. And the MHRA has been following this from the start. And so they've been doing parallel assessments of the efficacy and safety of it. It's great to see coordination come together like that between government, regulators and industry to produce something so quickly but safely.
Yeah, and the sort of international cooperation of scientists has been
absolutely
stunning, hasn't it? It's been incredible. Beyond vaccines and beyond testing, which we've talked about, what else needs to be done to control COVID going forward, or indeed presumably the next COVID, the next one that comes, sort of thing? I mean, what lessons do you think we've learned? Do you think we've changed it culturally in how we will behave in any way, or do you think we'll go back to as was?
For me,
yeah.
For me, it's wonderful that I can actually talk about what I do to the layperson and they understand what PCR is, which is fantastic. So the fact that diagnostic testing has now really been added to everyday lexicon is fantastic. And I think what we have learned is that decentralized diagnostic testing is extremely important during the pandemic. Centralization hampers and hinders progress. So I think that's something that's going to be absolutely wonderful. As we move forward, adding therapeutics to the vaccine and diagnostic testing is going to be important. But a much greater appreciation for infection control and general hygiene is just going to be valuable.
Yeah. Jeremy, anything on that? I mean, I guess one of my questions is how do we look beyond our borders when we think? Because obviously, state the obvious, it's an international issue, it's an international problem. How do we make sure that we sort of look beyond and work cooperatively?
Well, I think one thing is very clear from coronavirus, that the countries that were most effective in dealing with it were the ones that closed their borders most quickly, which is slightly depressing for internationally minded people, as I'm sure everyone on this particular discussion is. We waited way too long to do that. We actually have the advantage of being an island, so it's much easier for us to close our borders than countries which have big land borders, but we waited too long. So I think we will learn to react much more quickly when there's a global pandemic in the future. But I think we also may well change some of our personal hygiene habits. I mean, it's probably going too far to say that we're going to start wearing masks when we have a cold, as is considered common politeness in a country like Japan. But I don't know. I think it may be the case that actually mask wearing becomes a lot more common, and and I think that's not a bad thing if that's the case. We certainly think that's one of the reasons why Japan had more resilience than we have when it came to the virus.
Yes. Can I turn you a little bit to mental health, which is an issue that a lot of our sort of supporters are really interested in. I mean, there's a lot being written about the impact on young people from teenagers through to probably late 20s. What's your experience of what you're picking up about that, I think? And how are we going to deal with what potentially is a significant mental health crisis when the economy is going to be so stretched? How can we persuade people that this actually, in the same way as Jeremy was talking about at the beginning about what needs to change and what we need to think about as a country going forward, I guess in the description, in what you described, you'd put mental health within that as well. How can we have that conversation with people so they're prepared to recognise that is core to what needs to be there going forward? Jeremy?
It's too early to say, Sally, what the actual impact of the pandemic and sustained periods of lockdown and isolation has been. We can tell that it's been very bad for some people who have, people with dementia in care homes have been in a desperate plight, but we don't know what the overall impact is. There's no raw data on, sort of, it's a gloomy topic, but on things like suicide rates that can give us too much of a steer on that. But what we do know with mental health, and we've known for many years, is that early intervention is key, and that half of all mental health conditions are established before the age of 14. So if you can nip them in the bud, you've got a very good chance that you can sort someone out for the rest of their life, rather than allow it to deteriorate into a condition they might have to be coping with for the rest of their life. And that's sort of part of the way the whole world has woken up to the power of mental health treatment. When you and I were growing up, if you went through a spell of depression, your grandmother might have said, pull your socks up, and no one would have really known that there was much you can do. That's all changed, and that's proved a massive relief for many people. But I think the lesson we need to learn is, and I think it's probably something that's a lesson that was a problem both in the New Labour decade and the Conservative decade that followed it, is that when you have an ambition to improve health provision, it's not enough just to throw taxpayers' cash at it. Basically, there is an inelastic supply of doctors and nurses. It takes 7 years to train a doctor, 3 years to train a nurse, but 5 years by the time you put on the university places and organize the whole thing. So you need to have a workforce plan stretching at least 10 years ahead. And in mental health, that's incredibly important, because, if we want quicker access to CAM services for young people, bring down the waiting times for people's assessments and treatments to start, we're just going to need a lot more professionals than we currently have. And the place to start, frankly, is training more therapists, mental health nurses, and doctors, and that's where I think we should be starting.
How do we build support for that across the party? Somebody, Wendy's just commented on the chat, one of the issues, potentially a bit like with social care maybe, is that in a fixed political cycle, it's quite hard, isn't it, to decide where are the priorities going to be and what are you going to do without having a broad base of political support that goes beyond the party boundary. How can we try and build support for what you're talking about?
I think there is absolute cross-party support on mental health issues. I think there's some very, very Norman Lamb, when he was an MP until the last election, worked with me very closely on it. He was a brilliant minister for mental health. We've got Nadine Dorris, who's very committed now, and there's some big voices on the Labour side as well. So I don't think there's an issue about support. And funnily enough, because Boris Johnson has prioritised the NHS, I don't think there's actually, I negotiated a big increase in the NHS budget. It's not actually so much an issue of money. I think it's an issue of how we get there, and the training. One of the things that I started, but needs a lot more oomph behind it, is the business of having a mental health lead in every school, in the same way we have a special education lead, as you will know, Sally, the Senkos. I wanted to have a teacher that was specially trained in mental health issues, and we've agreed that's going to happen. But it's a huge investment for schools to put that in place. And I suppose the only bit that we just need to iron out is how we make sure that in the process of doing this, we don't medicalize a lot of problems that might go away anyway, which is always the risk you have with mental health. And so that's why, in a way, we need to try and find ways to make people more mentally resilient and help them cope with a low patch without getting onto the NHS treadmill, which can medicalize a problem, which is why I think schools have such an important role.
Yeah. And do you think there's anything that we can learn from the kind of rebirth, if you like, of volunteering, of community spirit, that, because I think, we're listening to your description, and I completely share your view on quality in the health service being an absolute priority. The problem is it is resource intensive, it's people intensive. And I just wonder whether one of the lessons we're thinking about, what can we take from COVID and be positive about? How do we take that commitment that people have of kind of committing again to their communities and to their neighbours and their friends? How do we take that and not over centralise it, and actually make it real?
Yeah. Well, someone said to me recently, it must be very frustrating for David Cameron that his big society finally happened.
Yes.
And that's how it feels. And basically, what happens when you have a common foe is that people pull together. And so, I think it will change us. I think we'll also get back to normal more quickly than people feel at the moment, but it'll leave something behind, a certain wisdom in the same way, frankly, that happens when you lose someone in your family and you go through that terrible grieving process. You come out of it a bit more worldly wise, and I think it'll be a bit like that for us as a country. And I hope it will mean that we can move on from the sort of the Scylla and Charybdis of modern politics, which is this gyration between populism and technocrats, neither of which really work terribly well. We need to find a more, I don't want to use the phrase middle way because that'll make everyone vomit violently, but we do need to find a sort of...
You quite like that in my day.
I thought you would, yes, but we need to find something that is that basically isn't as remote as those kind of that meritocratic centrism of Cameron and Blair, but isn't as unpredictable as the populism of Trump.
Yeah. Jono, can I come to you? Because what's your experience in the Northeast? How do you, a few questions, and I'm picking up partly on what people have been asking. What do you think is going to happen to the office or to the workplace? Because, everybody's got used to spending all their time in front of Zooms and Teams, but we all, instinctively think we're missing something. Where do you think the balance is going to be going forward? First question. And secondly, what's your views? Are you going to stay in the Northeast? And if you are, how are you going to build the skill base, or how are you going to encourage the Northeast to build the skill base that you need for entrepreneurs like you to put real energy into the region?
Right. Okay. So I'll start with the office question first. So we've had key worker status, all of us at QuantuMDx, and we've got a large building here, 4 floors, lots of people working here. We haven't shut down once. We've had, as I said, multiple cases of COVID that we picked up early with PCR. So the way in which we can get back to the office is regular PCR testing of all staff. Simple as that. We do it every day. You could probably get away with it every 3 days. You pick up people before they become infectious and isolate them. 0 transmission in the office. That's how we get back. It's very, very simple. In terms of how do we start building out a life science diagnostics clinical entrepreneurial base in the Northeast? Investment. It is very, very, very difficult for us as a company in diagnostics in the Northeast to get the scaling investment that is required. Even now, and this is shocking, and a message that I do want to get out. We are trying to raise funds in a pandemic. We have developed and proven a swab to answer PCR device that can operate in 30 minutes. It is the silver bullet of diagnostics that will allow people to get back to work, to get back to the new normal. And we are struggling to raise investment. And one of the reasons that we hear over and over again is you're not in the Golden Triangle, Oxford, Cambridge, and London. And so there's a significant bias against the Northeast that we just need to address.
So you think that is actively preventing, so it's not so much about the skills of the people you can recruit, it's actually about who's prepared to invest outside that triangle.
Yeah, absolutely. We have a multinational workforce here at QuantuMDx. We've got people from all over Europe, all over the world. We have no problem attracting people because they recognize the quality of the technology. We also have Newcastle University, Northumbria, Durham, Edinburgh on our doorsteps. So getting skilled workers is not a problem. It's getting access to capital. That's the problem. And it's easy to get the seed investment, the Series A, but getting anything to scale significantly is very tricky. And we're constantly being courted by states in America and in Asia to move. But obviously, we don't want to do that.
I think that's been looked at. That's been looked at several times by select committees, to my knowledge. Certainly, when I was on in the Lords, I remember looked at that issue. Jeremy, have you looked at that issue?
Not in detail, but we're it's a good candidate.
Yeah. I think in terms of lessons coming out, certainly. Okie dokie. I've got a question. Maybe it's you, Jono. Maybe, but I mean, it's something I know that Jeremy would be interested in as well. Thinking back to lessons that we can take, not just for the UK, but beyond. Are there lessons from what we've gone through in 2012 and indeed others in terms of the treatment of TB and malaria in poorer countries going forward? I mean, are there direct lessons that we can take and that Britain can be part of leading, I guess, and explaining?
From my perspective, we set the company up to do TB diagnostics, another airborne respiratory disease. And so, so we certainly know an awful lot about low to middle income countries, diagnostics, etc. And what we need to do looking forward is start to take a lead in equitable access to diagnostics, vaccines, and therapeutics in these countries, or else they will just be reservoirs for these diseases to come back through air travel. And so if we do not take the lead, we do not push this, and we have to have that difficult conversation with the pharmaceutical companies to provide access to their research and technology so that they can do in-country manufacture of this virus. Now, it's a difficult conversation because intellectual property is owned by, for the underlying process of creating these vaccines, but groups like Gavi will provide a safe way to facilitate that. And that's going to be very, very important as we move forward, or else we're not going to control this globally.
Jeremy?
I think that one of the sort of scarier thoughts that people have had during this pandemic is what would have happened if coronavirus had started in Africa, where there are some of the least developed healthcare systems in the world, rather than China, which, for all its faults, has got a strong state and a semi-developed healthcare system. And if we are going to be better prepared for the next pandemic, we need to strengthen healthcare systems in the poorest countries in our own self-interest. And that's why, one of the great advances of this year has been the speeding up of the vaccine research and production process. But we need to think about what Jono's been saying. And that's why I happen to think one of the reasons, amongst many, that I happen to think it would be a big mistake to cut our aid commitment from the 0.7%.
No, it's a prime candidate of actually the whole of what we're trying to do coming together, isn't it? That it just makes complete sense. Yeah. Can I ask a question about the relationship between the government and the media? Watching the last 6 months, 9 months, what's worked well, what hasn't? What needs to change going forward in terms of trying to develop a grown-up conversation with the public? Jeremy?
I think that government communications has got better during the course of the pandemic. I think the government started off in campaigning mode. The comms team at Number 10 had been through the Vote Leave campaign, Boris's leadership campaign, a general election campaign, and they had a formula which is based on finding a simple slogan that cuts through to people who aren't really interested in politics. And in a way, we had a good slogan, protect the NHS, save lives. But I think in a pandemic, you don't need to ask for people's attention. Actually, everyone is engaging, and you need to have a more sophisticated dialogue, which I think we started to have, because everyone wants to know the truth. And I think you need to, you learn to set expectations much more carefully, that facts are going to change, the approach is going to change, policies are going to change as we get more information in a rapidly changing situation. So I think, in fairness to the government, I think they have been on a journey over the course of the year in terms of how to pitch the tone right. But now I think they're in a much better place. They're celebrating the vaccine, but also being honest with people that we're not at the end of the road, and there are still going to be restrictions over Christmas, for example. So I think we are in a better place.
Yeah. Jono, what about messaging on testing?
Oh, so yes.
Quite a lot of negative views about how effective the messaging testing has been, I think.
Yes, no, it's been tricky. I mean, diagnostic testing is not simple, and when someone is putting together a communication strategy that and don't have the level of knowledge to back that up, it does get confusing. And I think the messaging has been too simplistic and has not educated first. And I think that's been I think education is really important with diagnostic testing, or else you're left wondering why we're not using this test that's 99% sensitive, but of course it's only been tried on 5 people. So it's been interesting to watch as an expert in the field. That's for sure.
And what's the lessons? I mean, we've talked about testing quite a lot. What's the lessons in terms of tracing going forwards? Because Jono, you said test and trace, and you emphasise trace as being absolutely crucial in terms of how you've managed to run your own business. Have we got the balance right now between central and local, Jeremy, in your view? I mean, how important is the app going forward? How much do we need to still use sort of local public health, or indeed local kind of community leaders, faith leaders, whatever?
I don't think we ever quite got that balance right. We were too slow to get test and trace going. I mean, they started in Korea in January. We didn't start till May, and we've been over-focused, I think, on testing targets rather than the end-to-end process, which is about getting people to isolate who could pass the virus on. So even in August, some of our, I think only 20% of people being asked to self-isolate were actually complying. But we thought we were doing very well because the testing target was gone up from 100,000 and was on track to be 500,000. Yeah. So I don't totally agree with Jono, and I think that there was a need for centralized testing resource. The Lighthouse laboratories, the scale up on testing was so huge that I think it would have just taken too long if we'd been totally decentralized. So I do see the need for a centralized testing capacity. But the trouble with those centralized capacity is that there's time it takes to get the samples to and from the centralized laboratories in Milton Keynes or Glasgow or wherever. So I think what we should have probably done, and I hope we do next time, is have a system where you have central resources like big testing laboratories, but actually the whole test and trace process is led locally. And I do think we should have put local councils completely in the driving seat, basically following the German model, where a local authority thinks it's its job to find and isolate every single person who could pass on the virus. And I think that probably is a lesson. I'm not convinced about centralized contact tracing. I'm not sure if you're called by someone in a call center 300 miles away and told to stop going to work, and you're a taxi driver and you're not feeling ill, your chances of complying, I think, are going to be significantly less than if it's from a local authority who could actually send someone around to check that you are self-isolating and so on. So I do think we need to think hard about that bit of our response.
And how do we make sure that we really do sort of package together the lessons, often which are quite small? Somebody just said on the chat, there was a very good example in Peterborough where by simply putting a callback number on, it really shifted the numbers of people being traced. And I think there must be loads of that across the country. I don't know. I've certainly have always struggled with how on earth we share good practice, how we learn, and how we don't reinvent the wheel again. We've all reinvented the wheel lots of times, I fear. How can we gather that together going forward?
Well, my view is that in a pandemic, you have to act really fast. And so the best thing to do, and I don't think we did this as well as we could have actually, is you just got to look at where in the world is doing this best and just copy them. And in the case of this pandemic, it was pretty clear from the outset that South Korea, Taiwan, Singapore, even China in some ways, were managing to contain the pandemic with a much smaller proportion of their population catching it. And actually all those places avoided a national lockdown. And Korea had they got the virus long before us. They had a super spreader event in a church. It was looking pretty grim in Korea. Yeah. they never had more than 9 deaths on any one day.
Yeah.
So I'm a great believer in copying best practice wherever you can find it. Now, what they do in Korea is they access your mobile phone and credit card records to find out where you've been, which I don't think this country would have been ready for in January.
No.
But as a temporary pandemic measure, I would just ask the question, would we consider that in the future, given that this year, all in, people in China, for the first time in our lifetimes, have had more freedom to move around their country than we have had in the UK.
Yeah.
So, I think we just have to be honest with ourselves and say that we kind of, we risk condemning ourselves to unnecessary national lockdowns with enormous collateral damage to the economy, unless we're prepared in times of pandemic to be temporarily flexible with some of the shibboleths that we ordinarily would live by.
Yes, maybe it's time for a new conversation about ID cards, but not calling them ID cards. But there's something
I knew you'd find a way of sneaking that in, Sally. I knew you would.
Life could have been different. Final question, I promise you. And I'm going to go to Jono first. What are you optimistic about and what are you pessimistic about? And I'll ask Jeremy exactly the same.
Well, I'm very optimistic about the life science sector, the diagnostic sector in the UK. It has been turbocharged thanks to the pandemic, and fortunately for the pandemic. And so it is exciting to see a focus on our great science. And what we are doing in the UK is world leading. From diagnostics to vaccine is incredible. Pessimistic, I'm still pessimistic about the funding environment in the Northeast.
Yeah, fair enough. Jeremy.
I'm optimistic that we will bounce back faster than most people think. And I think actually, funny enough, even if we end up, which I know none of us want, with a no deal scenario, I think there's incredible resilience in the economy, much more than people think. I remember asking someone once what the impact of 9/11 was on American GDP growth. And the whole business of 9/11 knocked less than 0.5% growth of US GDP in 2001. So I think we have a very resilient economy. So I'm optimistic about that. And I'm optimistic actually about our chances of embracing things for the future, because whichever side of the debate you're on Brexit, when it happens, it will have a very catalyzing effect on us as a country in terms of making us rethink how we're going to make our way in the world. I'm a little bit pessimistic about public finances, and I think that that is going to make winning the argument, for example, for a proper 10-year settlement for the social care system harder, because they are going to feel as grim as it was for George Osborne in 2010. And so I think that's going to be tougher, but I think we have to make the argument, look, if we as a country were able to set up the NHS in 1948, when our national finances were even more shot to pieces by the Second World War, then surely we've got the imagination to sort these problems out today.
And there's been more of a spotlight on social care, arguably, than there has been for a long time, because it's just been so visible, hasn't it?
Yes, I don't think any government will actively, deliberately, studiedly walk away from solving social care. But what tends to happen with social care is it gets delayed and delayed and delayed. And that's what I'm personally very keen to make sure doesn't happen.
Yes, thank you. Thank you very much indeed to our speakers. That's been brilliant. We could go on a lot longer, but we are going to let you go. But thank you very much indeed. And this is the beginning of a conversation that I'm sure we will continue with Big Tent. We're going to stay open, I think, Susie, aren't we, for anybody who wants to stay for a little bit longer, but in an informal way. And I know you're going to stop recording. So, but thank you very much indeed. It's been great.
Thank you all. Lovely to see you, Sally. Bye. Bye, Jono.
Cheers. Bye, Jeremy. Thanks, Sally.